Help your heart with a little weightlifting. New research suggests an hour or less each week of weightlifting might significantly cut your risk of heart attack or stroke. Scientists found that small amounts of resistance exercise weekly were linked to between 40% and 70% fewer cardiovascular events. The study involved nearly 12,600 adults over more than a decade. Weightlifting uses muscle resistance to strengthen and build muscles. Other types of resistance exercise include push-ups, sit-ups or lunges. Cuts risk for stroke and heart attack up to 70% by practicing weightlifting for only an hour weekly. Strength training is a foundation for good health, especially as you get older. Importantly, lifting weights is not just about keeping your musculature strong, it has a number of other health benefits that at first glance may seem unrelated, including improved metabolism, cognition and mental health. Strength training is also important for heart health, and recent research shows less than an hour of strength training per week can reduce your risk for heart attack and stroke anywhere from 40 to 70%. Weightlifting protects against heart attack and stroke. The study in question, which had a mean follow-up of 5.4 and 10.5 years, analyzed data from nearly 13,000 adults taking part in the Aerobics Center longitudinal study, looking at 3 health outcomes: non-fatal cardiovascular events such as heart attack and stroke, all cardiovascular events, including death, all-cause mortality. Strength training reduced the risk for all 3. According to the authors, compared with no resistance exercise, weekly resistance exercise frequencies of 1, 2, 3 times or total amount of 1 to 59 minutes were associated with approximately 40 to 70% decreased risk of total cardiovascular disease events, independent of aerobic exercise. However, there was no significant risk reduction for higher weekly resistance exercise of more than 4 times or 60 minutes. The fact that the cardiovascular benefits of weightlifting were independent of aerobic exercises such as walking and running means strength training is sufficient in and of itself. It alone will lower your risk of heart attack and stroke, even if you don't meet the recommended guidelines for aerobic activity. The U.S. Centers for Disease Control and Prevention recommends at least 2.5 hours of moderate-intensity aerobic exercise each week, 75 minutes of vigorous intensity activity, or a combination of both. Weight training is cardiovascular exercise. It's worth remembering that cardiovascular exercise involves any physical exertion during which your heart and respiratory rates accelerate. While most people equate cardiovascular exercise with aerobic exercises such as running or cycling, fitness experts note you cannot fully access your cardiovascular system unless you're performing mechanical work with your muscles. So, strength training is in fact a cardiovascular workout. Overall, in this particular study, resistance exercise was found to influence cardiovascular event risks in 2 ways, as it had a direct U-shape association with cardiovascular disease risk, indirectly lowered cardiovascular disease risk by decreasing body mass index. It's also noteworthy that even small amounts of strength training can have significant benefits. As noted by Duk-Chul Lee, associate professor of kinesiology and one of the study's authors, people may think they need to spend a lot of time lifting weights, but just 2 sets of bench presses that take less than 5 minutes could be effective. The results are encouraging, but will people make weightlifting part of their lifestyle? Will they do it and stick with it? That's the million-dollar question. Interestingly, your grip strength has also been shown to be predictive of your heart attack and stroke risk. In one study, there was a 17% increased risk of cardiovascular death, a 7% increased risk of heart attack and a 9% increased risk of stroke for every 11-pound decrease in grip strength. In fact, grip strength was a stronger predictor of all-cause and cardiovascular mortality than systolic blood pressure. Strength training also lowers risk for metabolic syndrome. Lee's team has also analyzed the relationship between weight training and metabolic syndrome, a risk factor that raises your risk for type 2 diabetes, heart disease and stroke, and high cholesterol. Again, less than 1 hour of resistance training per week lowered the risk of both metabolic syndrome by 29% and high cholesterol by 32%, and again these reductions were independent of any other aerobic exercise. Lee commented on the results, saying, "Muscle is the power plant to burn calories. Building muscle helps move your joints and bones, but also there are metabolic benefits. I don't think this is well appreciated. If you build muscle, even if you're not aerobically active, you burn more energy because you have more muscle. This also helps prevent obesity and provide long-term benefits on various health outcomes. Leg strength linked to cognitive health. Strength training also benefits your brain. In fact, there's a strong link between muscle strength, especially leg strength, and cognitive health. This fascinating link was again demonstrated in a recent study published in Frontiers in Neuroscience, which shows that neurological health is as dependent on signals from your large leg muscles as it is on signals from your brain to your muscles. According to the press release, this finding fundamentally alters brain and nervous system medicine, giving doctors new clues as to why patients with motor neuron disease, multiple sclerosis, spinal muscular atrophy, and other neurological diseases often rapidly decline when their movement becomes limited. In other words, whenever you're unable to perform load-bearing exercises, you not only lose muscle mass due to muscle atrophy, but your body chemistry is impacted in such a way that your nervous system and brain also begin to deteriorate. What's more, by not using the leg muscles, 2 genes were adversely impacted. One of them, known as CDK5-RAP1, plays an important role in mitochondrial health and function, which is yet another important reason for getting weight-bearing exercise. Another, perhaps key, factor that helps explain the link between muscle strength and brain health is related to how exercise affects brain-derived neurotrophic factor (BDNF), a remarkable rejuvenator found in both your muscles and your brain. In your brain, BDNF helps preserve existing brain cells, activates brain stem cells to convert into new neurons, neurogenesis, and promotes actual brain growth, especially in the hippocampus area, a region associated with memory. Many other studies have confirmed this intriguing muscle-brain link, including the following. Walking boosts hippocampal volume. In a 2011 study, seniors who walked 30 to 45 minutes, 3 days per week for 1 year, increased the volume of their hippocampus by 2%. Typically, your hippocampus tends to shrink with age. The results prompted the authors to claim exercise as one of the most promising non-pharmaceutical treatments to improve brain health. Leg strength maintains cognitive function. A 2016 study in the journal Gerontology found that working your leg muscles helps maintain cognitive function as you get older. According to the authors, simply walking more could help maintain brain function well into old age. The study followed 324 female twins, aged 43 to 73, for a decade. Cognitive functions such as learning and memory was tested at the outset and at the conclusion of the study. Interestingly, leg strength was found to be a better predictor for brain health than any other lifestyle factor they reviewed. Consistently, the twin with the greatest leg strength maintained higher cognitive functioning over time compared to her weaker twin. The stronger of the pair also experienced fewer age-related brain changes over time. Leg workout enhances memory. A Georgia Tech study found that 20 minutes of strength training enhanced long-term memory by about 10%. Resistance training reduces age-related brain shrinkage. Resistance training also helps reduce shrinkage of white brain matter, thereby improving your cognition. In one study, elderly sedentary women taking part in a 12-week strength exercise program improved their cognitive ability by 19%. Before you get started, take a moment to evaluate your level of readiness for strength training by considering some important cautions. Check with your doctor first if you are a senior citizen who previously has not been physically active, are currently dealing with a serious illness, have a chronic condition, such as low back pain or a bad knee. It's best to warm up your muscles before launching into strength training because cold muscles are more prone to injury than warm ones. 5 to 10 minutes of brisk walking or another aerobic activity can help warm your muscles. As you do each set of repetitions, listen to your body. If you experience pain, stop the exercise immediately. You might try again by changing your posture or position or using less weight. Using proper technique is an important aspect of strength training. Not only will good technique help you avoid injuries, but it will also ensure you achieve maximum benefits from the workout. Thanks for watching. Please like, share and subscribe to my channel Healthy Lifestyle.